Okay, go.
Cardiac arrest, take 1. Okay, so we arrive on scene. Wow, I'm gonna fall over. Arrive on scene, somebody laying unconscious. Neighbor is here. Say hi, what was going on today as I approach the patient?
He was shoveling snow, and then he...
Hello, sir.
His chest, he said his chest was hurting, and he collapsed.
No response to painful stimuli. Triggers me to go to CAB, so I feel for a pulse. No pulse. Firefighter, can you start CPR? Partner, can you get pads on right away, please? I'm going to grab an OPA and go to the airway. So I'm going to turn my attention up to the airway. Look at the airway. He's getting pads on. Let's say that there's something in the airway. Pads on. Can you turn the monitor on, please?
Mm-hmm.
Remove it. Here. I wonder.
Low battery, analyzing heart rhythm. Do not touch the patient. No shock
Okay,
advised.
so no shock.
Pause. If needed, begin CPR.
Feel no pulse. Go ahead and start CPR. Do you want to hook up the bag valve mask for the oxygen and get it running at a couple of liters a minute? So we've got airway in. We're going to initiate breathing. 32. You'd continue chest compressions until he gets the bag valve mask up and going in. We're just doing continuous chest compressions until he's ready to assist with the breathing. We could go to 32 with one person. So what was happening today?
He was just shoveling, and he came over and told me he wanted to go to the hospital. His chest was hurting.
Okay.
Then he collapsed.
Okay. So as we've gone through them, it's hard not to. Do you want me to teach or just do?
Just do.
Just do.
Yeah.
Okay. So we're just starting off CPR. Does he have any history of coronary disease at all?
I'm not sure.
Not sure. Hasn't been told any heart problems.
No,
Does
just
take
lip
nitro
sign.
under his tongue?
I don't know.
Do you know if he has any medications at all?
No.
Okay. So I'm going to just go through my H's and T's so you know what I'm doing here. I'm going to start off with my H's. As far as hypovolemia, do I feel pulse with compressions? Do I see any evidence of bleeding externally? Does he have a history of recent surgeries or anything like that that would kick me towards that?
Yeah.
I'm going to take my stethoscope, put it in my ears. I'll wait till the next time. So next time we do a breath, if you remind me, I'm just going to listen to see if we have air entry bilaterally to see if we have a tension pneumothorax, and to make sure that as far as addressing hypoxia, we're going to give him high flow oxygen. And does he have any history? You don't know if he's on home oxygen, has nasal prongs in his nose, anything like that?
No.
Okay. And did he mention before he collapsed if he's been sick in the last few days?
No.
Didn't mention anything.
No.
Okay.
He just looked like he
So-
was in a lot of pain.
Analyzing heart
Okay,
rhythm.
just stand clear.
Do not touch the patient. Shock advised. Stay clear of patient. Deliver shock now.
Okay, I'm clear, you're clear, everybody clear, shocking now.
Shock
Right back in the
delivered.
chest. I'm going to get you to switch actually. You should use chest compressions. We could have coordinated that a little better.
Begin CPR.
Yep. So because we had no pulse during analyze, we just continue right into CPR. So we don't know as far as hydrogen ions, hyper or hypokalemia. I look at his arms and see if I have any diabetic shunts or anything, or dialysis shunts as we're going through. And he's obviously not cold. What number are you at?
9:30.
Okay. Okay, I get good air entries in the APC, so it's not tension pneumothorax, and as far as hypoxia, we're addressing it as best we can. Cardiac tamponade, I have a pulses with chest compressions. I don't know if he's had any history of infection that would lead to that, so I can't ask really. As far as toxins, don't know. Yeah, it hasn't proven really helpful. And given that he was out shoveling snow, it would seem that he is most likely having acute coronary syndrome, or maybe a pulmonary embolism that's led him to this. But either one, I can't do anything at this point. So we've kind of addressed those H's and T's. Okay. Given that the family has very little, the neighbor has very little history, it's going to be I've already asked if they have allergies. She doesn't know if he's on any medications. Doesn't seem to know. Do you know any past medical history of him at all? Okay, no idea anything to eat or drink or anything like that. So this is typical of a situation where somebody's not really well known. So we don't know a lot of history, which leaves a lot of unknowns for us. So we're going to focus on doing really good CPR. And so at this time I could actually go ahead, because we're kind of got a lag here, I could actually go to a King LT now and try to go to continuous chest compressions and ventilations. Partner, am I missing anything? You can't think, he's just doing. Anything come to mind?
Analyzing heart rhythm.
Yeah.
Do not touch the patient. Shock advised. Stay clear
Let's get
of
ready to
patient.
switch for CPR
Deliver
if you don't
shock
mind.
now.
Okay.
Clear.
I'm clear, you're clear, everybody
now.
clear, shocking now.
Shock delivered.
And I'll change the
Pause.
rhythm.
If needed,
So keep
begin
going, because we felt no
CPR.
pulse during analyze. Okay, do you want to grab a King LT and pull it out? And every time, whenever you're getting close to 30, do you want to get him ready? And we'll just, when you get to 25, get ready to bag.
25,
And I'll get an IV started, okay?
29, 30. Nope.
In one of those tubs.
What's up?
Is the man can move over there in one of the tubs? How's compressions going there, Dan?
His?
Yeah.
Go again.
I'm sorry, ventilations. How's ventilations? How do you look?
Compliant for me.
Compliant for you. So, because we don't know his history, a leader's not gonna hurt him, I'll just start that IV and open it wide open, okay, during cardiac arrest.
I can't find
That's-
Well, I can't stick it in
we'll
anyway.
just say, we can just say it's in.
Analyzing heart rhythm.
Okay, well,
Do not touch the patient.
that.
No shock advised. Pause. If needed, begin CPR.
I've got a pulse. Can you get me a blood pressure, please? Do you know how to take a blood pressure? Okay. Just gonna turn and look at his airway and see. So we have a pulse, everyone back? We have a pulse? We're gonna find out. Just gotta look in his airway, see if there's anything in his airway. We'll say there's something more there, so we'll suction him out. Okay, we'll put that back in. Didn't quite get the King LT in because we
Would we
didn't.
continue to put it in after this?
If he doesn't wake up, we can absolutely, let's just keep ventilating him for the time being. We'll get to the King LT in a second. Just set it here and it'll be clean. And we'll just ventilate him. A breath every 6 seconds. Can you give me, so we're C. Nice big breath. Okay, I get good air entry. So breath every 6 seconds. So we just dial this down to 10. Every time you hear a noise, give him a breath, okay? Seems like a long time. Nice slow breaths, great. What did our blood pressure come back as?
Blood pressure?
We'll say it's 68 on 40. So we're gonna continue that IV running wide open for the time being. We're gonna give bolus, probably in this amount of time, depending on the IV catheter. If this was a 22, it tells you on the IV catheter, it's different per IV catheter, but this will give 65 mils per minute, approximately, okay? So we're 10 minutes, right? So we're getting 650. Whereas an 18 is much bigger. We'll show you the difference. I don't know if you've seen that or not, but it's substantially, I can't remember, I think it's around 200 mils per minute, 150 or something mils per minute in an 18. I'll have to go on, so it's much quicker. So we can flip this over to monitor at this point, and that's where we're going to end as far as today for ROSC. Okay, I know. So a little bit complaining that we have some PVCs in here. So as far as CAB, we're just looking, do I have a pulse? Can you get me a blood pressure? Turn your attention to airway, suction airway, make sure it's clear, start breathing. And I would absolutely at this point, Dan, start to put a King LT in. Once we're making sure we're breathing right now, because remember, before we had large apneic periods when we were pulseless, just with compressions, we're getting some ventilation a little bit from compressions. I don't know that you can consider that ventilation, but you get a little tiny bit of gas exchange, especially if you're using one of the things that the things that label that. But we had large apneic periods. So if you slide that King LT in during that apneic period, it's no difference. Well, as soon as we have a pulse, I think that I would think about this as pre-oxygenating again. I think I'd give him good 2 minutes of good ventilation. Both A, does he wake up? And B, let's make sure he's pre-oxygenated as best we can before we create any apneic periods. Does that make sense?
Mm-hmm. Yep.
Okay. So we can stop that. Did that stop?